shouldn't be using Tylenol, used unless it's absolutely positively necessary, and don't be given Tylenol to young children for virtually any reason either. All this, the administration recently claimed that there was a link found between Tylenol and autism, and Tylenol maker Kenvue, the parent company, says in part that we believe independent sound science clearly shows that taking acetaminophen does not cause autism. So let's welcome in now for a conversation on this the president of Disability Voices United, Judy Mark, actress Tal Anderson joining us as well, also been very vocal about her own autism diagnosis. Judy, do you want to start us off on this latest comment from the president in the context of the larger conversation that a lot of people, mothers like you have been having over the last number of days? What would you say to people?
Yeah, as a mom who has a son with autism, who didn't take Tylenol while I was pregnant, I think this is just fear-mongering. And it's also really quite disrespectful to the autism community. We are asking for dignity and supports and services, and instead he's like chasing headlines and being very political and opportunistic at this time when there's absolutely no real evidence that there's any connection between taking Tylenol and having autism.
Tal, someone who is not only a member of the autism community, but an advocate for that community, what have you been thinking about?
These false statements about Tylenol and a cure for autism are not supported by science. The dubious manner in which it's being presented to vulnerable people, autistics, their parents, and women in general, is also ridiculous. None of these statements are backed by proof, science, or even expert statements. Why would anyone take this seriously?
Judy, you said a moment ago that there are things you do need, right? You were talking about what you are advocating for. So is that a way of saying this is kind of a distraction? And if so, a distraction from what? Like what's not coming to the autism community that, in your view, should be coming your way?
Yeah, this is just smoke and mirrors to be distracted from the fact that the president and his party in Congress just cut $1 trillion for Medicaid. And we are, absolutely going to be devastated by this when this goes into effect, and don't really care about the fact that, he's trying to chase headlines. And like right now, what we need are supports and services.
Okay, I want to ask you something of a devil's advocate question, Judy, in just a moment. But Tal, would you agree with what Judy just said, or what would you add to what's needed?
Listen, if this administration really cared about autistic people and pregnant mothers, for that matter, they would stop making stigmatizing, unproven claims and instead provide what really matters to us: funding for health care and supports we desperately need to remain healthy and independent in the community. Instead, they're silencing the disabled community. They're eliminating our rights, our health care, our support, and our ability to pursue happiness, and unconstitutional.
I guess the devil's advocate question, Judy, would be something to the effect, and I've heard others say this, that for years and years, people have been taking a similar approach to this problem, and now there are new eyes looking at it in new ways. And isn't that, in and of itself, at least a positive, that we're at least open to new thinking? So how would you respond to that?
I don't spend my time every day thinking about what caused my son's autism and and how to cure it, because I don't think that you'll be able to figure out an absolute specific cause, because autism is so diverse, and we're never going to cure autism. And so I really think that parents need to stop chasing that dream. But it's not even a dream that I have, because my son gives so much to the world. Even though he requires 24/7 supports, he's a bit different on the spectrum than Tal. Although she really speaks for his needs, he is not very verbal, but he is able to bring so much joy to this world, and we should be respecting that.
That's beautifully said, actually. Tal, would you add to that in terms of, I guess it's called a spectrum for a reason, and the different strengths that people bring from different, places on that spectrum? What would you say from not only your own personal experience, but your advocacy experience there as well?
Well, what I can say is that the words being used by this administration are most definitely dangerous, false, and misleading. He makes it sound like autistic people add no value to the world, and he's wrong. The disregard for the autistic community and the blocking of our input on policies affecting us directly is unacceptable and dehumanizing, and it needs to stop.
Our continued conversations on this issue affect so many Americans, and we thank you both for your personal thoughts on it. Tal Anderson, Judy Mark as well. Thank you, Judy. We're going to take a quick break and be back with more in just a moment here on NewsNation Now.
Let me tell you a story about a shy, bullied kid diagnosed with autism. But this boy had a dad who refused to let that diagnosis define his child. That boy is me. Born Lucky, Sunday at 8/7 Central on NewsNation.
At Morgan Stanley, old school hard work meets bold new thinking. To help you see untapped possibilities and relentlessly work with you to make them real.
Wait a minute. This isn't slang, which gives me the most important